This is your spine, the cervical portion at least. We're missing some of the front views of your mouth, but this is the back of your jaw. Your teeth are here. The darker areas are any dental work that you've had. So two primary things that we're looking at when you swallow um, are here. So the liquids and solids come in here. They're going to get transferred to this section here, which is the throat phase. As long as the food and the liquid stay along the back of the throat, which is right about here, it's going to enter the esophagus and then make its way down into the stomach. So I want to make sure nothing goes towards the front. That's the wrong pipe. The expression going down the wrong pipe, that would be the wrong pipe.
The lighter colored one in the front?
Yeah, kind of. The esophagus is a collapsed tube, so we can't really see it open.
Okay.
But the trachea is always open. It's more rigid, so this is the trachea. The esophagus is just behind it. And
Gotcha.
you can't see it because it's collapsed. So anything veering towards the front is going the wrong way. Second thing that I'm looking at is after every swallow, the throat should look like it does right now. This is a still image before we started, so there's nothing in the throat except for, what should be there. If anything stays behind in these areas here, right, any of these areas, that tells me that whatever you just swallowed, something's staying behind. So
Okay.
that would be residue. Those are the two main things that we're looking at. So as I start to play here, I'm going to go frame by frame, otherwise it goes very quickly. But you just took a sip of liquid. All right. And the first thing that I notice is that the timing of the swallow is off, so it's a little bit delayed. By the time the liquid hits right about there, for a person your age, the trigger, the timing, should have started. But it actually occurs right about here, so it's pretty late. You get a little tiny bit of liquid that tries to go the wrong way. You can see it right there. But the vast majority is going down the way it's supposed to. That little tiny bit of liquid is right there. A little bit stays behind. And that's why I suggested, 2 or 3 swallows in that you clear your throat. It's for that little bit of residue that stays behind.
Okay.
All right. So here on this second swallow. All right, so I think this is the second swallow or the third swallow. Same sort of thing. The vast majority goes where it's supposed to. Little tiny tail right there of the liquid trying to go the wrong way. We can see the outline of the residue there. You're sort of compressing, holding the swallow. Little tiny bit of residue, but for the most part, everything goes the way it should. This little bit of residue here is the only thing that I'm concerned about, and that's why I suggested that throat clear every so often. Okay? But otherwise, everything, the vast majority is going down the way it's supposed to, and very small amounts of residue stay in these two recessed areas here, the piriform sinuses and the vallecula, which are normal holding areas for the swallow. But again, a little bit of residue right there. And eventually, gravity is going to pull that down, pull it down towards the airway, which is what I want to prevent for you. All right. Now, here, I believe this is the applesauce. You're going to move back into frame here in just a second. So that's the applesauce. And what, the striking thing about this compared to the liquids is, the bulk of the solid goes where it's supposed to, but notice the darkness right here. That's applesauce that's still left in the throat. You kept mentioning that you felt like it was in the esophagus. Well, the esophagus really doesn't start until here, and then it goes down here. So everything that we're seeing is in the throat. So that little bit of residue here. And the reason for that is there's two things that are happening here. Your base of tongue, which is supposed to go back and make contact, base of tongue here, make contact with the back of the throat and compress or propel everything downward. And then your epiglottis, which is this cartilage here. The epiglottis is a little bit truncated, which is a result of the radiation, and it's a little more rigid than it was before, so it doesn't flex like it did. And then the base of tongue doesn't make as well a contact as it did after the radiation. And so this is the reason you have to flush everything, right? Take lots of liquids to get it down. Again, here's another sip to rinse, but the same thing. A little bit of liquid sneaks in beforehand, and that's because of the delay. See it a little more pronounced here. But, during the exam, no significant aspiration. There were a couple of instances where the liquid gets pretty deep and it actually makes contact with the vocal cords. But I think you're pretty sensate to it, so you clear your throat almost instantly and you clear it out. So this is the mixed fruit. So the fruit cocktail, the syrup, and the fruit. Right there, there's an instance where some of that liquid sort of spills forward. We see a little residue there, and that liquid drops down, and that's getting pretty close to the vocal cords now. So right there, it is sitting right on top of the vocal cords, and then right there, that is an instance. There's a tiny amount of that liquid that fell just below the vocal cords. You can see it pronounced there again. But here you cleared your throat, you got it out. I no longer see it, so this area is nice and clear. So that throat clear is a very effective strategy for you. And continue to do it spontaneously, where you feel it and you react, and then also, as I've instructed, every 2 to 3 sips, even if you don't feel like you need to.
Okay.
This is the cookie, and we're going to see the most residue with this compared to anything else. So this technique that you have where you chew the food and then you flush it with liquids, you end up with a lot more deeper penetration and more significant penetration. So that's liquid trying to go the wrong way. And that's because you're just kind of flooding that chamber, right?
Yep.
But the whole time you do a really good job of keeping keeping the airway protected. There is a little instance where a little bit of that liquid again drops below the vocal cords, but I think just simply with the compression of the swallow, it clears out. Maybe a little slight amount stays there. But again, that liquid that stays behind, that throat clear is really important. Yeah, see it redemonstrate right there. But again, overall, a lot of good, strong, extra swallows. Some of this residue that stays behind, the only way to get rid of it is just to keep swallowing. But this is, after swallowing several times, kind of clearing your throat, some of that residue we saw before is now gone. And the airway is clear, which is always the most important thing. Now, we're not going to see any barium because you use water, but basically that area is flushed out. Pill's still in your mouth, so you're still kind of struggling pulling that back. Eventually, you transfer it. It does get caught in here, which is something I would have expected because of the reduced, flipping action of the epiglottis and some of that reduced base of tongue. But again, you just sort of persisted with the liquid and swallowing, and eventually the pill went down. And that's it. So overall, what you're eating and drinking, keep it up. Keep experimenting with new foods. Understand that drier, sticky foods are going to be the most problematic because they're going to have the greatest tendency to, stick in here. But use the flushing technique that you're using, the water rinse or the liquid rinse, bearing in mind that every 2 to 3 sips you're going to clear your throat and swallow again, and then lots of dry swallows.
Okay.
The swallowing exercises I recommended, you got to keep doing them, right? So kind of we got through the thick of it, during treatment, but you're going to have the exercises are going to serve the purpose of maintenance and continuing to hopefully rehabilitate your swallow as much as possible. Some of the effects on the epiglottis may be permanent, so it may not ever flip like it did before. It may be just too rigid after the radiation, and so you're going to have to compensate and continue to compensate like you're compensating now. But based on this, with no significant aspiration and the ability to clear the throat like you're clearing, yeah, you're definitely safe to eat and drink. So that feeding tube, as you can start replacing meals 100% by mouth, that feeding tube's no longer necessary.
Yep.
As long as, they surveillance and the doctors feel like you're in the clear, right? So
yeah, that's the goal, right? So, good.
That's it. Yep.
Cool.